I lost you.
Yeah, I think they're reconnecting.
Oh, okay. Can you see me?
No, I think yeah, as well I lost your. No, both back.
There I am.
Back.
Yes, both back.
Yay. Did you get a phone call by chance, Wanda? Because sometimes if it'll kick you out if you're getting phone calls or text messages.
Yeah, we have.
Um,
Nope.
But this is
Okay.
an
Just making
iPad.
sure.
Probably you won't get a call from your iPad.
no, I won't.
Yeah.
That's true.
Okay.
Um, Jessica, Jessica, Lindsay, I mean, Lindsay, Lindsay.
Dr. Hamid Abbasi is a neurosurgeon who is transforming spinal surgery, and he's training surgeons across the country on his new
Could you
revolutionary
bring me the
procedure.
chair? This
And
one
he's
is
joining us this morning to
precarious.
tell us a little bit about it, along with patient Wanda Grell. Good to see you two. Thanks for joining us.
Yes.
Thank you for having us.
Of course. Okay, so let's start with you, Dr. Abbasi. Now, you have found a way to perform surgery, back surgery on patients without it being such a life altering surgery. A lot of people are afraid of the downtime or the incisions, but this is different.
Yes. Spine is a very complex structure, and like I use usually analogy to a car that our spine is made of bone and disc interspersed, and each disc act like a tire of a car. And when you get old, those tires wear, and when they wear and tear, and the bone grinds the bone, it push on the nerve. That can be extremely painful. I'm sure Wanda can explain to you how painful and limiting that can be. And on top of that, sometimes our spine, instead of going straight up, like in Wanda's case, because the discs are collapsing unequally on each side, it bends to one side. We call this degenerative scoliosis. And in a situation like that, we try all the conservative management, but sometimes that's not enough. Then we have to approach the disc and literally straighten the spine, separate the bone, and take the pressure off the nerve. This has been traditionally been a very long, very invasive, and very damaging surgery by itself. And in open old-fashioned surgery, for lack of other term, we fillet the patient open to just get in, and that put the patient on a very long path to recovery with lots of damage that our body have to fix. Now we do the surgery through a tube that is barely bigger than a pencil, and we perform the fixing of the spine without all the damage that comes in the traditional spine surgery with getting into the spine.
Now, Wanda, you were the perfect candidate for a procedure like this. You are one of the doctor's patients. Can you tell us a little bit more about how your life was before you had the surgery and how you're doing now?
Well, I've had scoliosis all of my life, and it was just getting increasingly awful for me because it was painful and I wasn't moving well. And I went to the Mayo Clinic prior to seeing Dr. Abbasi, and they wanted to do my entire spine in a 2-day surgery. And I would have been in a care center for months and months and months. And my brother, who is a pretty darn good chiropractor at the time, he said, "You won't survive that." And he knew Dr. Abbasi from some, I don't know how, I can't remember, but he recommended me going seeing Dr. Abbasi. And Dr. Abbasi said, "No, you can't do that. And we have a better way of doing it." And so um, he did not do my entire spine. He did the worst 3 levels, and it was still quite something because you know my spine was in a bad shape. So he can explain that part better. But I tell you, it was life changing for me because I could move without pain, and I still don't have pain. I very rarely have pain, and I but I do. have some difficulty with my balance, and I don't know if that's from my I was knock kneed pretty bad, and I still am, and so that's part of it, I think.
Well, I'm so
So-
glad that you're doing so good after the surgery. I know, Dr. Abbasi, you're actually training surgeons around the country on this revolutionary procedure. So we want to give everyone more information on it to see if they're an ideal candidate, to see about this new procedure. All the information you need. All you got to do is visit inspiredspine.com. The tag? Okay. Oh, do I do all my verbiage or just easy tag? Okay, tell me when. Anytime? So for more information on this revolutionary procedure, to find out if you are an ideal candidate for it, you can find it all at inspiredspine.com.
And I would say do it.
I would like as well to add a picture of Wanda's back before the surgery. As you see here, the spine that should go straight up and down is now almost jackknifing with the angle that we call it Cobb angle at 40 degree. And as you see, practically bone is touching the bone. In a healthy spine, the bone goes straight up, and between those white area, which is the bone, the dark area, which is the disc, there is at least somewhere between half an inch distance. And now in Wanda's back, not only spine is jackknifing at 40 degree, which is very unusual and very bad, but as well bones are grinding the bone. And as a matter of fact, the dark spot inside of the disc, as you see there, is where literally the protein and the cartilage are falling apart and releasing a gas from the protein. So that is literally, the disc is rotting inside of us. That is what the dark appearance comes from. And obviously this is the pre-op picture that shows a very severe pathology. Wanda, we might have lost them.
Yeah, I think so. But I tell you, Dr. Abbasi, I am very blessed that I had the surgery with you. I can't thank you enough for what you did for me, and I still see you, and you said I could possibly have more surgeries. So I'm not afraid of them, because I know that you will do the best you can. And I think you did the worst part on my back first.
Yes.
On my spine. So if the tailbone area disintegrates because of how bad it is, I'll do it, But right now, I'm real careful how I land on the on things, so I don't jar my tailbone.
Yeah, well,
And